Psychological, social, and economic impacts of infertility. Infertility is a medical condition that not only affects physical health, but also has profound psychological, social, and economic consequences. The journey of dealing with infertility often involves emotional distress, social stigma, and significant financial strain, making it a complex issue that requires comprehensive support. 1. Psychological impacts of infertility. Infertility can have a profound effect on an individual's mental and emotional well-being. Couples facing infertility often experience a range of emotions, including emotional stress and distress, feelings of frustration and anxiety. Couples may feel anxious, frustrated, and hopeless as they face repeated unsuccessful attempts at conception. The uncertainty of treatment outcomes can heighten these feelings, leading to emotional distress. Depression. Studies show that individuals with infertility are more likely to experience symptoms of depression. The prolonged nature of infertility can lead to feelings of hopelessness and helplessness. Grief. Many individuals and couples experience a sense of loss, especially after repeated miscarriages or failed treatments. They may grieve the loss of a biological child, future parenting dreams, or the life they envisioned. Guilt and self-blame. Individuals may feel guilty or blame themselves for infertility. Women, in particular, may feel a sense of personal failure, especially if societal expectations regarding motherhood are strong. B. Impact on relationships and self-esteem. Relationship strain. Infertility can place a strain on intimate relationships, particularly between partners. The stress of infertility may lead to increased conflict, lack of communication, and feelings of isolation. Impact on self-perception. The inability to conceive can negatively affect an individual's self-esteem. Women may feel less feminine or less fulfilled, while men may feel inadequate or responsible for the infertility. Sexual dysfunction. The stress of infertility can also affect sexual intimacy. Couples may feel that sex becomes more of a means to an end, i.e., conception, rather than an intimate connection. This shift can lead to anxiety, sexual dysfunction, and further emotional distance. C. Psychological disorders. Post-traumatic stress disorder, PTSD. Infertility treatments, particularly those involving ART, assisted reproductive technologies like IVF, can lead to trauma-related symptoms such as flashbacks, nightmares, and hypervigilance. Adjustment disorders. Some couples may develop adjustment disorders as they struggle to cope with the changes infertility imposes on their lives. The uncertainty of treatment and the inability to control the outcome can result in chronic stress and difficulty adapting. D. Coping mechanisms and mental health support. Coping with infertility often involves seeking therapy or counseling, support groups, and couples. Therapy may help individuals and partners cope with emotional distress. Cognitive behavioral therapy, CBT, mindfulness-based stress reduction, and other therapeutic approaches can help individuals manage anxiety and depression related to infertility. 2. Social impacts of infertility. Infertility often affects individuals socially, both within their personal lives and in broader society. It can lead to stigmatization, strained social relationships, and feelings of isolation. A. Social stigma and isolation. Cultural and societal pressure. In many cultures, parenthood is seen as a natural and expected part of life. Those struggling with infertility, especially women, may face societal judgment or the pressure to just relax and let nature take its course. Feeling of exclusion. Couples undergoing fertility treatments may feel excluded from social events, particularly family gatherings or events involving children. They may also experience isolation due to friends and family not understanding the emotional burden of infertility. Stigma around assisted reproductive technologies, ART methods such as IVF, egg donation, or surrogacy can be viewed with skepticism or as unnatural in some communities, adding to the feelings of shame or embarrassment for those seeking such treatments. B. Impact on family and social circles. Family dynamics. Infertility can alter family dynamics, especially when one partner feels blamed for the condition. Pressure to fit in with family expectations of having children can create emotional tension. Loss of social connections. Infertility may affect a person's ability to interact with others. Some couples may avoid family or friends who have children, fearing that they will be reminded of their struggles. This can contribute to feelings of loneliness and social isolation. Impact on parenthood. Goals. In cultures where having children is seen as a crucial aspect of marriage, couples facing infertility may feel disconnected or alienated from their social roles. C. Social support and coping strategies. Support groups. Many people dealing with infertility turn to support groups, both in person and online, to share their experiences and gain insight into coping strategies. Peer support can reduce feelings of isolation and provide a sense of community. Communication and counseling. Social support is crucial for coping. Couples may benefit from relationship counseling to strengthen their bond and improve communication about their infertility journey. Talking openly about infertility can reduce stress and enhance emotional well-being. 3. Economic impacts of infertility. Infertility can have significant economic consequences for individuals and families, particularly as fertility treatments are often expensive and not always covered by insurance. A. Cost of fertility treatments. High financial burden. Assisted reproductive technologies, ART, such as IVF, are expensive and often require multiple cycles. A single IVF cycle can cost thousands of dollars, and additional expenses for medications, consultations, and other procedures can add up quickly. Insurance coverage. In many countries, fertility treatments are not covered by insurance, making it financially inaccessible for some individuals. In other cases, insurance may cover limited treatments, leaving patients with a large out-of-pocket burden. Ongoing treatment costs. Many couples require more than one cycle of IVF or ART procedures, which can significantly increase the overall cost of treatment. B. Opportunity costs and financial strain. Delays in career or education. The financial strain of infertility treatments may cause individuals to delay other life goals, such as career advancement or completing education, in order to afford the cost of treatments. Debt. Some couples take on significant debt to finance infertility treatments, which can lead to long-term financial strain. This debt, combined with the emotional burden of infertility, can cause additional stress. C. Impact on productivity and work. Workplace absenteeism. Infertility treatments require frequent medical appointments, leading to time away from work. This can affect productivity and may be particularly challenging for those with demanding jobs. Reduced job satisfaction and career growth. The stress of infertility, combined with financial difficulties, can negatively affect job performance, satisfaction, and career progression. D. Economic benefits of fertility treatment access. Improved access to treatment. Countries with better access to fertility treatment services report a lower economic burden associated with infertility. Universal healthcare coverage that includes fertility treatments can reduce the financial strain and improve outcomes. Cost-effective solutions, improving access to treatments and increasing awareness about the availability of fertility preservation, such as egg freezing, can help couples manage infertility at lower long-term costs. 4. Conclusion. Infertility is a multifaceted issue that affects individuals psychologically, socially, and economically. The emotional strain of infertility often leads to depression, anxiety, and grief, while social isolation and stigma further complicate the issue. The financial burden of fertility treatments adds an additional layer of difficulty, often leading to death and career delays. As access to treatments improves and society becomes more understanding, individuals and couples facing infertility will be better equipped to cope with these challenges. Addressing the psychological, social, and economic impacts of infertility is crucial for supporting affected individuals and promoting equitable access to reproductive health care.